This is getting towards the end of our simulation video, and the requirement is to discuss special populations with a client with high blood pressure, lower back pain, and either a shoulder or a knee injury, and I've selected shoulder injury. So for this session that we've done, firstly discussing high blood pressure. High blood pressure is a condition of elevated systolic and diastolic blood pressure. Anything above 120 on 80 is considered to be high blood pressure, and that needs to be diagnosed over 3 consecutive days. So a client would go to the doctor 3 days in a row and get an elevated reading on each of those days to be diagnosed, and that might be elevated systolic, so for instance 135 on 80, or it might be elevated diastolic, say 120 on 90, or it might be both, say 140 on 90. Any of those scenarios constitutes high blood pressure, and the client will be either managed by being monitored, or they might be medicated to get that blood pressure down into an acceptable range. In any event, unless the patient has arterial high blood pressure, there's no contraindications for the session that we've done. So our client with high blood pressure could participate with all of those exercises without any modifications. In questioning the client before exercising, we just want to ensure that arterial high blood pressure is not their current situation, in which case they need to have a medical clearance. So yeah, I'm happy with that session, as it would be for anyone with high blood pressure. It'll be beneficial for them. It will lower their blood pressure, increase their fitness, and overall their health outcome will be better. The next one would be for lower back pain. So lower back pain is defined by pain in the lumbar region of the spine. That could be due to perhaps poor posture, or it could be poor core strength. It might be something to do with their work, or they could have actually injured themselves. So with that scenario, we're just wanting to first exclude that the patient or client has no injury. That's not the cause of their pain. It might just be during exercise it gets a little bit sore. So some changes to that workout that we've just done. We probably want to eliminate anything where there was a strain on the lower back. So we're going to remove that squat and replace that perhaps with maybe a horizontal leg press, or something where there's no pressure on the lower back, and replace that barbell row with maybe a supported row. So maybe use one of the pin-loaded machines where there's a pad at the front for the client to rest upon, which takes away the strain on the lower back. There's certainly no reason why we can't still train that their back and still perform some leg exercises with that strength training. The chest press can stay as it was, and also the fitness test can stay as it was as well. In regards to the cardio with lower back pain, I think we'll remove the rower and probably remove the bike as well, so they're not bending over too much, and we can replace that with perhaps the cross trainer and maybe the treadmill. I think probably they go a little bit easier on the back than cycling and the rower. The last scenario is a patient with a shoulder injury, and if it's the case of the shoulder is actually been injured, we're just going to assume that they're under the care of a health professional, and the health professional should be able to advise us at what stage their recovery is, and how the fitness professional can implement an exercise prescription. So that's what we're going to be looking for. We're not going to try and take it upon ourselves to rehabilitate the client. That falls in the hands of the health professional to instruct us on how we might rehabilitate that shoulder injury. For the session that we did today, we're going to want to take out that upper body aspect of the session until we get a chance to converse with the health professional, be it a physio or an exercise physiologist. So those changes are going to be, we're going to get rid of the push-up test and change that to a wall squat, taking away the upper body. We're going to get rid of the upper body aspect of the strength training as well, and until we have a clear idea of how we can handle that shoulder, maybe we'll change everything into lower body until such time we've spoken with the health professional. After talking with the health professional, he may say that certain angles are okay. For instance, The client might find pressing in a 90-degree fashion is comfortable, but pressing above the head is not comfortable. So we're going to maybe find which angle that might be. So again, it comes back to talking to our physio or our exercise physiologist, and they're going to give us some guidance on how we can instruct our patient to train safely. So I think that pretty much covers those three scenarios: high blood pressure, no contraindications, lower back pain. We're going to make a few changes as discussed, and for the patient with the shoulder injury, we're going to remove the upper body aspect, so there's no rowing. We're going to change that to treadmill or cross trainer. There's going to be no boxing. We're going to change that to maybe plyometrics on the legs, and instead of doing bent over row and a dumbbell press and the push-up test, we're going to change that to wall squats and have a lower body workout instead. I hope that covers everything we need to do. Thank you.